Begin.
Start.
Hello,
Hello.
I'm calling for Max Forge.
Yes, doctor.
Well, hello, I'm Dr. Shahab. I'm one of the doctors from the GP practice. Uh, I'm calling you regarding you had requested a phone appointment. Is that right?
Yeah. Yes, doctor.
Well, thank you. What may I call you, please?
Max.
All right, Max. Before we get started, I'd just like to make sure I'm talking to the right person. So, can you confirm your age for me?
It's 21, doctor.
Thank you. And would you confirm your first line of address, please?
It's blah, 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 blah.
All right, all right. Thank you so much. So I understand from my notes that you have been having a headache. Is that right?
Yes, doctor, I do have headache. Yes.
All right, all right. Well, I'll do my best to help you with that. So can you tell me about it, please?
It started when I woke up, and I do have this headache now for 3 hours, and I don't
Mm-hmm,
know what's that. What's that headache, doctor?
Got it. Okay. Is this the first time you got this headache?
Yes.
All right. And you mentioned it just started this morning, 3 hours ago. So did it come on suddenly?
I woke up with it, doctor.
Got it. Okay. And where exactly is the pain in your head?
All over my head.
Okay. Does the pain go anywhere else?
No.
All right. And have you noticed anything that makes this pain better?
Nothing.
All right. Anything making it worse?
Nothing as well.
All right. So, other than this headache, is there anything else you noticed that's bothering you?
The light is bothering me a bit.
Can you tell me a bit about that, please?
What do you want to know, doctor?
Well, do you find that the lights are too bright?
Yeah, it's bothering me. Yeah, I want to be in a dim room. Yeah.
Okay, I understand. All right. So, can you please tell me, Max, have you noticed any rash on your body?
No,
Okay. Have you been having a fever by any chance?
no,
Mm-hmm. Okay. Any chest pain?
no,
Have you vomited or felt sick?
no.
All right. So, uh, can you tell me, Max, have you noticed any difficulty moving a part of your body?
No, doctor.
Is there any pain in your neck?
No.
All right. So, Max, can you tell me, please, um, about your general health? So, do you have a diagnosed medical problem?
No.
All right. And are you currently taking any medications?
No.
Do you have any allergies?
No.
All right. And a bit about your general life, Max. So, can you tell me, um, do you drink alcohol?
Actually, I'm not drinking, but yesterday, I was in a party
Mm-hmm.
and we won a football match,
All
and
right.
yeah, I drank alcohol with vodka and wine. Yeah.
All right. All right. Got it. So, is this your first time drinking?
Yes.
Okay. Okay. May I ask how much did you drink yesterday?
Um, Maybe 3 or 4 cups of wine with vodka.
Mm-hmm.
Yeah.
I got it. Got it. Got it. Okay. Do you smoke, Max?
I don't smoke now.
All right. And um, you mentioned to me that you had a football match. Is that the sport you play?
Yes.
Okay. Do you practice the sport regularly?
Yes.
All right. Okay. Um, so Max, do you have any idea what might be causing this headache you're experiencing?
No.
Okay. And well, I know about the headache, but I want to know about you. So, what is the number one thing that's concerning you?
I just need anything to ease this headache. It's horrible.
All right, I understand. I'm really sorry to hear that. We should be able to help you with this. Okay. And is there, other than that, is there anything specific you're expecting from your appointment today?
Nothing specific.
Mm-hmm. Okay. All right. Well, um, thank you for answering my questions and bearing with me, Max, so far. Um, from what you've told me, it does seem that what you're experiencing is something called a hangover headache. Have you ever heard about it before?
No.
All right, I'll explain it to you.
2 minutes
This
remaining.
headache is related to alcohol consumption, and you mentioned to me you had this party yesterday and you had a lot of alcohol, and it was your first time. So it is likely that what you're experiencing is the effect of the alcohol causing you this headache.
Okay.
Okay?
Yeah.
So, uh, you mentioned you wanted something for the pain. We should be able to help you with that. But in
Mhm.
your case, painkillers are not the most helpful thing. In fact, the most helpful thing would be to make sure that you drink a lot of water, make
Mm-hmm.
sure that you drink a lot of juices, and keep yourself well hydrated. Are you following me?
Yes, doctor.
All right. Another good idea would be to eat small, frequent meals to keep yourself well nourished, and this headache should go away on its own after some time. Are you following me?
Yes, doctor.
All right. I'd like to advise you about something as well, Max. Uh, it's not advisable that you drink in large amounts suddenly because it can cause you to vomit, it can cause you to lose your balance and get hurt, and it
Mhm.
has a damaging effect on your body systems as well. So I would like to advise you that to drink in moderation within the recommended limit whenever you are drinking alcohol. Does that make sense to you?
Yeah, it makes sense, doctor. So, could
Um,
it be alcohol poisoning, doctor?
well, it is unlikely to be alcohol poisoning because alcohol poisoning would maybe would maybe cause you loss of consciousness as well as other symptoms.
Mm-hmm. Okay.
And okay,
Move on to the next station.
Time's up. All right. Well done,
Shihab, doctor.
Dr. Shahab. Yeah, well done.
Thank
Well
you.
done. Okay. How do you feel?
Um, I feel like I could have done some safety netting. Unfortunately, didn't have time for it. I wanted to do some examinations, but it's not important to invite him to come over the phone. And I'm not sure how to handle investigations in a case like this, doctor, because it's
Okay.
over the phone. If it's something serious, obviously you'd have to invite them to come in, but in his case, I'm not sure if
Mhm.
I have to tell him to come in because the investigations are not that significant.
Yeah. No, do you think that you need to do any investigations for this patient?
I'm not certain.
Yeah, from your opinion as a doctor, do you think that this case needs any investigation?
No.
No. So no need to ask the patient to come. Yeah.
Yeah, okay.
Okay. Uh, okay. So what is your opinion about your data gathering?
Begin.
Well, I feel I should have asked a few more differentials. I didn't have them ready in my head, unfortunately. I think I should have excluded a couple of very important ones are the trauma and any possibility of a hemorrhage, which I did not ask the questions for.
Okay. What did you ask about chest pain?
I'm not sure. I'm just doing a quick systems check.
All right. Do you think it's relevant or
Not exactly, but if it's nothing serious, I tend to find myself stuck without anything to do. So I just like to check anything in the chest, anything in the abdomen, just move on. Just, just a wellness check.
okay? But take care because sometimes the irrelevant questions can affect your marks badly or negatively
Mm-hmm.
instead of
All right.
affecting them positively. All right?
All right, got it.
Hey, do you think that if you can give him an advice about driving would be okay?
I mean, yes, he is 21. He should be able
Yeah,
to
you
drive.
can include that in the management. You can tell him
Mhm.
as a safety netting, don't drive until you feel better, and try to calm, try to rest at home. And if he is asking you, can I go to my job? What is your answer in this case?
My answer is that you can take a day off from your annual leave, maybe
Yeah,
consider.
yeah,
And because we can't give him a sick note for this, he has to take a
yeah,
day from his annual leave. He can stay
yes.
home, he can rest a bit until he feels better and he feels competent to do his job, and definitely don't drive.
Okay. But just a correction, he can take a sick leave.
He
Okay?
can?
He can take a sick leave. All right? A sick leave, not annual, take a day from his annual leave. He can take a sick leave. The sick leave is a kind of if you are feeling unwell in the morning of one of the days, then you can call your work and tell them that I'm not feeling well, so can I take sick leave? Okay, if you take one day only as a sick leave, it's okay. You don't need to give any paperwork. If it's more than 1 week, you will have to contact your GP and take a sickness note and provide your work with it. Okay, so anyone can take sick leave for a period of time, but if it's more than 1 week, he should be able to provide a kind of sick note or a confirmation that he was sick.
Okay, so if as long as it's less than a week, he does not need a sick note.
Yes.
Okay, yeah, in this case, yeah, he can take maybe a
Yeah,
couple of
sick
days.
leave. Yeah,
Yeah,
sick leave.
got it.
All
Thank you so much.
right. Thank you, Dr. Shihab. All right, so let's talk about your marks first, and then we can see the questions, or we can see the questions at the end of this the session to avoid wasting of the time. Okay, data gathering. In data gathering, to be honest, you've done almost all of the important points. You explored the headache. Maybe you can ask me, is there any specific thing happened yesterday, just to have a clue? But you asked me about the alcohol. What else? You can ask me about the alcohol poisoning symptoms: vomiting, shortness of breath, loss of consciousness, and confusion. These are the symptoms of alcohol poisoning: vomiting, chest tightness or chest, shortness of breath, loss of consciousness, and confusion. You asked me about vomiting, and then you included loss of consciousness at the end when I asked you, is it alcohol poisoning or not? Well done. You can include the driving if you would like, either in the history taking or in the management. In terms of the examination, you can offer the patient
2 minutes remaining.
but in this particular case, it's not necessary to bring the patient to the GP. There is nothing alarming. Okay?
Okay.
So you handled it properly. Okay? In terms of your, so in data gathering, I think you are 3 in the data gathering. In the management skills, you explained the diagnosis very, very well. in the management, you told me about the advice, giving the advice to the patient in terms of taking painkillers, drinking and eating well. Small frequent meals. You can ask him to sleep very well, no alcohol in the next 48 hours, and you can safety net me about vomiting, shortness of breath, or feeling drowsy. Okay, so in the management, I think 3 as well. Interpersonal skills. I'm happy with your interpersonal skills, to be honest. You're calm, you're relaxed, you're asking smart questions. You asked me about the concern in a very good manner, and you explained everything in a perfect way, to be honest. So I could give you 4. Well done, Dr. Shihab.
Thank you so much, Doctor.
Keep it up, keep it up. Yeah. Okay. Nothing in the skills area, to be honest.
Move on to the next station.
Nothing in the skills area. Okay.
That's great to hear. Thank you so much, Doctor.
Thanks a lot. So for you doctors, I just need to share with you the picture that we have. The picture of the headache. Can you see this?
Yes.
Okay. It's a kind of reminder for you. Any acute headache, the differentials are trauma. You can ask about trauma, any specific thing happened like trauma. You can ask the patient in this particular case that we have done with Dr. Shihab, did you have any trauma to your head yesterday? Okay, then meningitis, you have any fever, any neck stiffness, any rash, then subarachnoid hemorrhage. You can ask about meningeal irritation. You've asked about them when you asked about or excluded meningitis. Then you ask about the neurological symptoms, facial weakness, arm weakness. All right, then vision problem, please. Vision affection, pain in the eye. Vision affection, pain in the eye. These are the most important differentials that you have to include in any acute headache. You can add some more if you have time, but these are the things that you can't miss. Okay? Trauma, meningitis, subarachnoid hemorrhage, vision affection, and pain in the eye. All right? If you suspect alcohol hangover, please ask about vomiting, chest tightness, and loss of consciousness to exclude alcohol poisoning. All right? Hopefully it is clear. The questions, what about investigations and examination over the phone? We have talked about this. Give ibuprofen. Yes, you can give ibuprofen. Avoid paracetamol. Can we ask about recreational drugs? Yes, you can ask. Casual leave, sick leave. If he is a student, you just ask him to have a rest. What are the red flags in hangover headaches? We have talked about them. Thanks. I think we need to do safety netting around these symptoms. Yes. All right. Please make sure that you do understand the difference between alcoholism and binge drinking. Okay? In this case, it is binge drinking. The patient doesn't drink alcohol usually. He had alcohol just once yesterday. It's a binge drinking. So in this case, you just advise him about avoiding binge drinking. But if he has a history of drinking alcohol, then you can tell him it's highly advisable to cut down alcohol to the safe limit for every week. Do you know the safe limit for each week? Then if you have time, you can tell him. All right, but please don't mix up the alcoholism or chronic alcoholism with binge drinking. All right? Okay, let's do the next one.